Okay, welcome back to another recording. So in this recording, we're going to look at some more muscles that move our arm, so moving our arm at our shoulder, as well as a few muscles that move our forearm, so moving our arm at our elbow. Okay, so starting from a posterior view, you may recall this muscle here, this is the trapezius, so we discussed this in the previous recording. What we're going to look at in this recording is this one just inferior to it, known as the latissimus dorsi, or latissimus dorsi. So as you can see, this is a very large, a very broad muscle that's going to attach onto our vertebrae. It's also going to attach to part of our sacrum as well, and some fascia. So this kind of white part of the muscle that you can see here, this white part, is some thoracolumbar fascia, so just this fascia that's part of our back and part of our lumbar vertebrae. And then it's going to run up, and it's actually going to attach to our arm. It's going to attach to our humerus. So this muscle, even though we see it on the back, and this is what you hear some people refer to as your lats, this is your latissimus dorsi. So this is an upper limb muscle. This is a muscle of your arm, even though the majority of the muscle belly itself is fixated on the back. All right. So this latissimus dorsi muscle is located here, and it travels anteriorly, and it attaches to, you can kind of see where it begins to end here, right up in this region here. It ends on a region known as the intertubercular sulcus, and this is a or intertubercular groove. Either one you can you can say either one. This is a region of the humerus that lies in between our greater and lesser tubercle, where this muscle attaches. So when this muscle attaches, you can see based on its orientation, it's going to primarily cause extension of the arm, so our arm at our shoulder going backwards, and a little bit of adduction as well. So we're bringing our arm back in. Okay, it can also cause slight internal or medial rotation. Okay, so that is our latissimus dorsi. Now, if we look up near our shoulder, I'm going to remove this latissimus dorsi on this side. You should see parts of our rotator cuff muscle. Remember, we had, if I remove this trapezius here as well, we had supraspinatus, we had infraspinatus, teres minor, and then subscapularis on the other side. One that we did not talk about is this one, that is called teres major. All right, this teres major is also attached to our humerus in this intertubercular groove or sulcus, and it allows for extension and a little bit of external internal rotation of the arm. So it causes our arm to rotate inward toward our chest. Okay, so this is known as the teres major, but remember, the teres major is not part of the rotator cuff, but the teres minor, you can see that one right here, the teres minor is part of the rotator cuff muscle group. Okay, all right, on the lateral aspect of the arm, you can see, if we move over to this side, we can see our deltoid, right? So the deltoid is this large muscle here. So we have this head, an anterior, a middle, and a posterior head here. This is all one muscle. This is all the deltoid muscle, and it has a couple of different functions depending on which fibers are contracting, or which head. So if the posterior head is contracting, primarily extension of the arm at the shoulder. If this one is contracting, the middle head, primarily abduction, right? We also talked about the supraspinatus being involved in abduction. And if this anterior one contracts here, we primarily have flexion of the arm at the shoulder joint. Okay, so the deltoid is very unique, located on the outside or the kind of external aspect of your shoulder. So if you feel your shoulder region, that large kind of meaty muscle that you should feel there, that is your deltoid. All right. All right, if we move on to the anterior aspect of our body, we should see this one large muscle in front, and this is our pectoralis major, right? So this is what we see right here, and it also has two smaller heads here. So it has abdominal, clavicular, and a sternocostal head. You should just know it as the pectoralis major. It also travels over, if you see here, it comes over and it inserts on our intertubercular groove, or intertubercular sulcus of the humerus, just like some of our other muscles like the teres major and the latissimus dorsi. So whenever this contracts, it's going to cause adduction, right? So bringing our arm in, and it can also cause some internal rotation as well, okay? So again, depending on which part is contracting, so again, you have these different heads, and in general, you should just be familiar with the just the pectoralis major as a whole, but this muscle can also cause flexion of the arm as well. So this is a very strong flexor of the arm at the shoulder joint. All right. You should recall, deep to our pectoralis major, we have the pectoralis minor, right? And so we've talked about this one previously. So here's our pectoralis minor here that attaches from our ribs 3, 4, and 5 up to the scapula. Now, if we move over to this side and we start looking at some anterior arm muscles. So here I'm going to hide our pectoralis major. just to get it out of the way, pectoralis minor. All right, so what we see here is we can see our biceps brachii. So this is this muscle right here. So here's one head, here's another head right here. And so the term biceps means two heads, right? So the two-headed muscle, the term brachii means on the arm. So this is the two-headed muscle on the arm, all right? You have a long head, which is highlighted here in blue, and then you have a short head, okay? Short head comes up and attaches to the coracoid process. Long head attaches to the supraglenoid tubercle, just on the superior aspect of the glenoid cavity, okay? Both of them converge and run together to form our biceps brachii tendon, which we see way down here at this distal aspect. So this is where the muscle inserts, and it inserts on our radial tuberosity, and when it contracts, it produces flexion of the arm at the elbow. It also causes slight supination, and this muscle can also flex the shoulder whenever it contracts. But it's largely, we generally think of it as working at the elbow. Okay, so again, we have a long head, we have a short head, and we have a long head a little bit more laterally. Okay, so if we hide the biceps brachii, just deep to the biceps brachii, we have a muscle called the brachialis. Okay, brachialis. Brachialis is a muscle that only moves the elbow. Okay, so remember we talked about in previous lectures that if a muscle crosses a joint, it has to act on that joint. Well, this muscle here, the brachialis, crosses only our elbow joint, so that humeral ulnar joint, so it's going to act on it. It does nothing to the shoulder. Okay, it does not cross the shoulder joint, so by definition, it cannot act on the shoulder joint. All right, it then runs down and it attaches onto the ulnar tuberosity of our ulna that we see right here. Okay, there's another one here called the coracobrachialis. The coracobrachialis attaches from the coracoid process down to the humerus, and this does flex the shoulder. Okay, it is crossing the shoulder joint, it attaches to the coracoid process, and so as it crosses here, it's going to cause slight flexion of the elbow here. So you can see flexion and adduction of the arm at the shoulder. All right. Okay, if we continue inferiorly, we have this small muscle right here known as the pronator teres. So if we look at this one right here, this is known as the pronator teres. Now, based on the name of this muscle, what do you think it does? Well, it's called the pronator teres, so it probably pronates the forearm, and that's exactly what we see. So if you recall, pronation is going from a palm down position, going from a palm up position to a palm down position. And so whenever we are in a pronated position, we actually have our radius and our ulna crossing each other, so they are not parallel. Whereas whenever we're in the supinated position, we have the radius and the ulna in a parallel orientation. So there's a muscle called pronator teres. There's also a muscle called supinator that's going to supinate the forearm instead of pronate it. All right. Okay, the last one that we'll look at here, there's this one and then one more that we'll look at. This one here, last one in the forearm, is called the brachioradialis. All right. So brachioradialis implies that this muscle attaches to the brachium, to the arm, and it travels down and it attaches onto the radius. All right, and that's exactly what we see. Now this muscle is kind of unique. Whenever we categorize muscles in our body, we categorize them into compartments. All right, and most muscles in a compartment perform the same function. They typically are innervated by the same nerve, and they may also have the same blood supply. Okay, but generally they have the same function or a very similar function. So this brachioradialis is technically in what's called our posterior arm compartment. Okay, posterior arm compartment, which are usually extensors. Okay, usually extensor muscles. However, this muscle here, this is a flexor. All right, this is a flexor muscle, flexor of our elbow. All right, so it's kind of unique. It is in the posterior compartment. It shares innervation with the muscles in the posterior compartment, which is the radial nerve, but it acts as an anterior compartment arm in the sense that it flexes the elbow. Okay, so you see here, it crosses our elbow joint, so because it crosses it, it has to act on it, and so it does just that by producing forearm flexion, okay, flexion at the elbow. All right, now the last one that we're going to look at is if we rotate posteriorly, we hide this part of the deltoid, we can see our triceps muscle, right? So if biceps meant the two-headed muscle on the arm, then the triceps brachii means the three-headed muscle on the arm. And that's exactly what we see. We have a long head here, we have a lateral head here, and then if we rotate slightly laterally, we can see this small sliver of what's called the medial head. So here's our medial head right here, okay? All three of these converge on our triceps tendon here that you see. This attaches to that olecranon process of the elbow, and whenever this muscle contracts, it produces extension of the arm at the elbow, right? So we're producing elbow extension. However, if we have the long head, so if we highlight the long head here, if this muscle is contracting, it can also produce extension of the shoulder, right? Because if you follow this muscle up to where it inserts on the scapula, it inserts onto the infraglenoid tubercle, infraglenoid tuberosity. However, the biceps brachii inserted onto the supraglenoid tubercle or supraglenoid tuberosity. So because this long head of the triceps crosses the shoulder joint, it is going to act on the shoulder joint, but only when this long head contracts. Whenever the lateral head and whenever the medial head contract, those are only moving the forearm, only producing extension of the forearm. All right. So if we hide this tendon here, you can see the if I hide this head here as well, and then this one, we can see the medial head a little bit better. Okay. So this is the medial head of the triceps, again, producing only elbow extension. But if we add those others back, then we can see, here you can see the whole muscle and how it can produce both shoulder extension and forearm extension at the elbow, okay? So we have covered these muscles. Please review these. And if you have any questions, please let me know.